One of the presentations I had during the MCAS meeting last week was about treatment of melasma with lasers. And it's important to understand what the nature of melasma is. Melasma is pigmentation which affects many people. There are two big factors which play a role in the development of melasma. One of them is hormonal factors, where we can see that some ladies will get the melasma during pregnancy because of the hormonal changes, and some other ladies are going to have more exacerbation, more darkening of the melasma during certain time of the months with the hormonal changes. The other very important factor which plays a role in the melasma is the ultraviolet exposure, where sunlight is not the only source of ultraviolet, where daylight lamps, fluorescent light can contribute in increasing the melasma because they have ultraviolet radiation. So it's really very important to know that playing with hormones is not the best idea to deal with the melasma because the risk of changing the hormones and hormonal treatment is much higher than getting some pigmentation on the skin. However, if we are able to protect ourselves from the ultraviolet by using the appropriate sunscreen, which is having SPF more than 30, and it has to be applied every 2 to 3 hours, this can control the melasma in a very nice way. In addition to that, there are some procedures which can improve the melasma, like lasers, some peels and so on, but we have to keep in mind that some cases of melasma might become worse and more darker pigmentation of the skin can develop after aggressive procedures like some lasers and some chemical peels. My talk or my research was about combination of fractional erbium laser with the hydroquinone application topically, so that we enhance and we increase the absorption of the hydroquinone in these cases. And we showed that the laser and the hydroquinone was much better on the skin, on controlling the melasma, than the hydroquinone, the cream only. And this is something which was able to prove. Having said that, my protocol always is to use microdermabrasion with bleaching cream and sunscreen, because this combination is going to be associated with no downtime at all, and usually it controls the melasma with no risk of hyperpigmentation or increase the pigmentation of the skin. So this would be a much better option than using a laser which is associated with heat, where heat can exacerbate and increase the melasma. So it's very important to understand the limit of any procedure we are doing, the risk of any procedure we do, and what to expect out of the procedures. We always tell the patients that once melasma, always melasma. There is no cure for melasma so far. Knowing that we need to control the melasma as much as possible by using the right protocol of sunscreen and to avoid the sun as much as possible is very important. And as long as we know the limitations and what we can expect from our problem, then everyone is going to be happy.